Hello and welcome to OCD Gamechangers COVID-19 Fireside Chats continued. We're so excited to be here at the end of the week. It's Friday, right? Yes, it's Friday.
Tuesday, Wednesday, Friday.
Everyone, it's Friday and no one's doing anything this weekend. TIGF no longer applies.
Good stuff.
Anyway, my name is Chrissy Hodges. I am the founder and the executive director of OCD Gamechangers. We're a nonprofit whose mission is to bring people together and create community for a disorder that is very isolating, that feels very much like we don't know if anybody understands us, and we really need that connection. And so part of why we're doing fireside chats right now is to help have some connection during this COVID pandemic that we're experiencing, and that's very scary for all of us. So I'm the founder, also the author of Pure OCD, The Invisible Side of Obsessive Compulsive Disorder. I'm a certified peer support specialist in the state of Colorado, working with people all around the world to help support them with OCD. And I also am, what else do I do, Josh? Oh, I'm the co-founder of Peer Recovery Services. This is we own a government contract that puts peer support specialists in the state institutions. And right now it's super needed. There's a lot of people scared out there, and peer support can be a real help. So with that said, I would like our guest to introduce himself. Tell us who you are, what you do, what you like, all of that stuff, Josh.
Awesome. I'm Dr. Josh Spitalnick, and I have eaten a lot of pizza and tacos for the last 2 weeks, like the rest of you. I'm a board-certified clinical psychologist in Atlanta, Georgia. I oversee a team of 8 anxiety and OCD specialists here in Atlanta, in a suburb called Dunwoody. I grew up in an area actually where Christy grew up as well. I believe in Marietta, Georgia. We're
Yes.
kindred spirits.
Yes.
So I oversee a team here in Atlanta, and we see kids as young as 3 and adults up to age 65, 70 for really mostly anxiety disorders. And a really great team of clinicians here who are servicing really now the Southeast United States in various ways, because we've finally broken the barriers of telemedicine and state lines, and hopefully I'm helping as many people as possible. But I'm a clinical psychologist, been in Atlanta over 40 years. I'm a musician and a father of 2 and the best husband in the world. And
I feel like we should bring up a mug right now that's like best.
I need something like that. I do have something from my kids years ago that says "My Dad Rocks." That's pretty cool. That's pretty good stuff.
That is awesome.
But most of it is I spend more time than I can even fathom thinking about and trying to help people with anxiety. Mm-hmm. I'm pretty public about it, and other things I do, where I'm the father of an anxious, now 13-year-old. She had her birthday last week. Happy birthday, sweetie. My wife and I work very hard to support her, but I spend a lot of time here in my practice and here in Atlanta helping people try and find what I think is the best practices or the best services for people who struggle with anxiety, OCD, and related disorders. And it is absolutely thrilled to be here with you on this glorious Tuesday morning. I'm just kidding. It's Friday afternoon.
I was like, oh my God, did I just say the wrong day?
Yeah. Happy 4th of July, everybody. No, this is awesome, Christy. I love what you're doing. I love what OCD Gamechangers is doing, and the events that you're putting out, and really all the dissemination of. There are really great resources around the world, not just here in the US, that you and other advocates do to sort of connect people, and that you are building sort of another foundation of providers and organizations to help people all around feel more connected and more supported. And so I'm just interested to see where this hour takes us, but it's good to see you again.
Thank you. Josh Spitalnick.
Like you dry yourself off with a towel.
Okay.
I got 3 siblings. 2 say Spitalnick, 1 says Spitalnick. So even in our own family, it's sort of it's a toss up. But I'm from Jersey. I got northeastern roots, so just Spitalnick up there, Spitalnick down here in the south.
Okay, well, because I was all Spitalnick.
I've heard it all as a kid. My wife did not
practiced
her last name when she married me.
Yeah. I practiced, and then I thought, wait a minute, I'll just have him say it, and then I don't have to say it.
I just Dr. S, Dr. J, or Josh. I don't care.
I'm just gonna call you Josh. How about that? So, Thank you for those kind words about OCD Game Changers. And I think you hit it on the head. What we're doing and what OCD Game Changers does in general is really about connection. I'm someone that lives with OCD. I lived with OCD for years, not knowing that I had OCD, and I almost died by suicide to OCD. And the importance of community that I have found that would have been beneficial before that, but also especially after that, and knowing I wasn't alone is so important. So when we have people out there, advocates and therapists doing these awesome projects outside their therapy practice and advocates outside their everyday life, we needed a space to elevate them. We needed a space for them to come together and feel like we are this community that's supporting one another and getting the word out. Because you know why? People advocating saves lives. The more information we get out there, the more people we can reach, the more people know they have OCD, the more they know treatment is available, and the more lives we will save. So that is our mission and our hope. And thank you, Josh, for being a part of it. You are part of the OCD Game Changers family.
Well, you are doing that mission through and through, and have done an amazing job, in my perspective, bringing together providers, people with lived experience, business professionals, grassroots projects, doing things around the country, really on a very small scale. I mean, it's just you and a few very lovely people working together right now, are sort of hitting the concepts of stigma and dissemination of what's out there and connecting people socially, whether it's right now in this medium or prior to coronavirus, really trying to connect people in other ways beyond just sort of these tele-based methods. You're doing what needs to be happening in all of mental health. So you and I have connected because of your lived experiences and what you're doing.
Uh-oh. Hi, Josh. There you are. Oh, hi.
Back. I'm here. Took a little siesta. We good?
Hey. You should see, I hope no one screenshot my face. It was like, Josh.
I'm here. I was just saying that you're doing a great job. Really what most mental health organizations, big and small, have a hard time doing, which is connecting people on the ground level who are directly impacted by it, to families, to organizations, and to researchers and clinicians. And most of the professionals in my field are so used to being in organizations where it's all ivory tower professionals. Mm-hmm. And what I love so much about you and everything you promote is it's sort of breaking the barriers of whatever level of entry you are, whether you're a loved one or someone who's struggling or a mental health professional or someone who's just new to the whole experience. There's space for everyone. And it's beautiful that you support and nurture that concept.
Thank you for that. I really appreciate that. And with that said, I do want to say, before we get into how you're feeling about COVID, I do want to say the greatest gift we have gotten back for OCD Game Changers are when people write to us and people come to us and say, I went to your event, or I've seen this, and now I've started this project, or now I've started this blog, or now I've started this. That shows us that what we're doing is inspiring other people to have the courage, because they know they have a platform and they know they have support, and that they know that we're going to back them up. And so, we could make space for you, by the way, later in this hour to talk about some of the things that you might be doing, but I will leave that up to you. So with that said, thank you to everyone for the support. Thank you for all of the awesome messages we've been getting and thanking us for doing these fireside chats. They've been so fun, a lifeline for me, and I know for so many other people. So with that said, without further ado, let's talk about what is going on. We're in week 3 or week 4 at this point of just total mayhem. How are you doing? How are you coping? How's your community responding, your practice? Tell us what's going on.
Sure. So personally, I'm doing, I think, pretty well. I'm actually in my office right now, my therapy office, and though where we are in Georgia, and specifically in a part of Georgia, DeKalb County, Downey, Georgia, has really, like a lot of places, decided to sort of have these shelter-in-place segments. I have chosen to continue to come to my office. Most of my team is doing everything remotely from their own homes or residences. We're offering 100% telehealth, like most of my colleagues around the country, which we had in place years ago. We were completely telehealth based, but I've been doing telehealth services for several years. So this was not a big shock to us digitally or technologically to get into this. So we were sort of lucky and ahead of the curve. But my team seems to be doing really well. as a profession. We still meet on a weekly basis over Zoom and other sort of platforms that connect, because we meet weekly, my team of 8 providers. My ability to do this, I've said this in other podcasts or platforms I've been on, is because I married up, and my wife, who works full time, she works full time in finance and banking, is kicking.
That is such a Southern thing to say, by the way.
It is. But she's kicking butt at home, doing the best she can to take care of her primary job as an employee, but is also making sure that my kids and their schedule and their needs are getting met on a daily basis. And I owe her everything for that. She's why I've been able to even build this practice and build my team here in Atlanta and do so many, I think, pretty awesome things in the field of mental health for the last few years, and be so creative and be so, I guess, entrepreneurial. It's because I have a partner who's made that possible. Mm-hmm. So I imagine there are many families out there like us where there's at least one person, if not 2 people, working and trying to figure out how the heck do you keep, the financial side of your family afloat and eat healthy and get out and be active and support the kids. And like most places, my kids, were out of school for a few days and then out of school longer. And then 5 days ago through April 24th. And then yesterday, finally, or 2 days ago, finally said, school's done for the year. And so we're all sort of constantly adjusting with each finish line that gets pushed back. So I can very comfortably say that I'm able to do my job, which not as a father, as a husband, but as a psychologist, because my wife's doing a really great job making sure that the family's being supported and cared for at home. So I'm very lucky for that. Mm-hmm. I think it's been fascinating, again, as someone who, as a team, we see lots of kids here. So we have about 50% kids, 50% adults. Again, most of the people that we see here have primary anxiety disorders. This may not be true for every provider out there. I've seen a few other people you've spoken with on the Fireside Chats and following through their blogs and podcasts where this is not the case. But in our practice, and I can, at least my 2 kids and anecdotally in my neighborhoods, I'm watching kids thrive right now. And I'm not saying that they're not struggling. And I'm not saying they're not getting sad or depressed or traumatized and that their anxiety is not spiking, but I'm watching mostly anxious kids be way less anxious, partly because we have so much scheduling and so many demands on them and so much pressures for school and so many extracurricular activities, and to go to sleep at a certain time and get off your devices and get up early. And I'm a part of the problem and hopefully part of the solution, but I'm watching so many kids right now, including our own practice, say, I'm okay right now. And it's not that I don't want to do this video thing with you, doctor, but school, plays, lunchrooms, driving, extracurricular, I don't have anything to worry about because I'm just at home with family, which you and I both know is not ideal. Mm-hmm. But I'm watching a lot of kids really not be triggered as much because most of the things that trigger them are socially based activities.
That's interesting.
So at least in our practice and in my community, I'm actually hearing from a lot of parents. Now, that's not to say the parents aren't doing well. I have parents that are struggling and freaking out and figuring what do we do now? But I'm watching most of our anxious kids right now actually kind of chilling out and finding a new level of comfort. And that doesn't mean that they're eating junk food and playing on video games all day long, but the amount of activities and scheduling that we put on our children, and to live up to some expectation of getting them to the best schools. I hope that there's some after post-mortem analysis when we're all said and done, Chrissy, and we realize that, wow, maybe we should be reducing our scheduling and reducing all these AP classes and reducing all the things we think our kids have to be in. And it's kind of sort of an observation of right now. And I'm watching parents right now on social media putting out the amazing things they're doing and all the new adventures are going on while they're stuck in their backyard. And I'm thinking, bull crap, hang out with your family, lay low. We're all getting behind in school. But if in 3 to 6 months you look back and go, my kid learned French, and that's the big gain right now, that's sad. I'm hoping in 3 to 6 months you go, I lived civilly with my children. We enjoyed each other. I hope to God I never have this experience with my family or my kids ever again. But if I'm going to have it now, I'm going to try and make the most of my time with them and sort of dumb down all the pressures of schedules and activities. I know in the first 2 days or 3 days of this on Facebook and everywhere else, we saw all these awesome schedules of let's schedule our kids. And I thought it was a good idea. We got to put them back on schedule. And that probably lasted 24 to 48 hours for most families. And those who have kept it up, I'm sorry. And those who have played a hybrid of it, I think that middle ground is what we all need to start thinking about well beyond this pandemic, because kids should not have to be forced to do so many things so many times. And I don't know. It's just an interesting thing I'm watching where most of our anxious kids like, actually, I'm okay right now because life is a little bit more chill. And
Mm-hmm.
I'll be more concerned in a few months when they're all back in school and back in structure and back in schedule. And a lot of kids who have separation issues or other sort of concerns when they're away from mom and dad. But sadly or ironically, I'm actually watching kids chill right now, and it's not a bad thing.
I have a lot of thoughts about this.
Yeah,
A lot of questions coming out of this, but what just a clarifying point. So in regards to maybe kids who experience social anxiety or anxiety in general, we're looking at just the reduction in the pressure
yeah,
equals reduction in anxiety. That's a really interesting correlation, I think. I mean, not that we wouldn't know it anyway,
sure.
but you're right. With the social pressures that most people have, especially with school kids, yeah, you might know it, but then again, it's like, oh yeah, but we have to do this. And so now we're actually getting a factual glimpse of that.
We are in some odd way peeling away the last 20 years of, I'm not going to say we've lost technology, but apps and fad diets and Ivy League colleges and whatever the last 20 or 30 years of sort of our generation put on us and that we're putting on our kids right now, like peeling away the layers and just going on walks and enjoying nature a little bit more, which you probably can do much more in Colorado than I can do here, unless I go to North Georgia. We're getting back to this very odd, simple, civil lifestyle. And again, in Atlanta with all the traffic, like I drive a little bit and I'm not hearing honking horns and people rushing through stoplights. And it just feels, despite this sort of very odd sense that we're all in, I've heard the word dystopia. And my vision is the movie Pink Floyd, The Wall, that there's this conveyor belt scene where they're singing, "We don't need no education." We're sort of all sort of being trucked along this conveyor belt of doom. I mean, I feel some of that, but I'm also feeling like people are sort of chilling out and being nice to each other and slowing down. And though it's not by choice, there ain't nothing wrong with that. And maybe I'm not the best example of that because ironically right now, professionally, I'm personally doing a lot more and I'm sort of seizing the opportunity. But I feel like collectively people are slowing down and there's something very elegant and simple about that and very less stressful and very less anxiety provoking, despite the fact that the future feels very stressful, very anxiety provoking and personally and financially scary. Talk about presence and living in the moment, Chrissy. If you can do that, holy crap, if you can do that now, 6 months from now, your life just got better. And so I'd encourage people to think about in 3 months, when you look back at this, is your narrative, look what I accomplished and look what I solved and look what I learned? Or look how well I handled my family, my friends, my own sort of sense of occupying my own time? And I think the second narrative is one that's much more exciting to me. And I think people should seriously take that to heart because I know when this is all over, we're going to rush back to schedules. And I think that's going to be a real traumatic time for everybody.
Mm-hmm. And just in checking in too, after hearing that, I'm just letting that sink in for myself as well. And through this last week and a half of doing, almost 2 weeks actually, of doing these fireside chats, I mean, my mood can be like stamped. Chrissy's irritated today. Chrissy's sad today. Chrissy's this today. But interestingly enough, hearing what you're saying, I may not have been able to receive it as well a week ago, to be honest with you. And I think that's a testament to how quickly things are changing for us every day. And there was a breakthrough, I think, a couple days ago. And I don't mean breakthrough because things have to be positive. I mean breakthrough because it was a change of mood and more a connection to mindfulness, which is exactly what you just said. I spent probably the better part of a collective week terrified about finances. I rely on clientele. My husband was furloughed without pay, and his side business relies on clientele as well. And so to see the reduction in that, my anxiety skyrocketed. And then it was a couple days ago that I actually woke up and I was like, kind of what you were saying, how can I connect to this moment and feel like I'm just more present with Sean or more present with our stepson, or because everything else is out of my control. Yes. I mean, everything. There's nothing I can do at this point except for continue to get support from people, continue to support people with peer support. And it really was this calming feeling that I have been hesitant to connect to, because as someone with anxiety and OCD, I would love to hear your thoughts about this. As someone with OCD and anxiety, the idea of mindfulness is terrifying.
Sure.
Because when I think about mindfulness, I have to connect to feelings that may actually bring sadness or anger, even though I love those feelings, to be honest with you, especially anger. But to bring it to the moment, I may have to face something that I'm terrified to face. When as we know through exposure response prevention, when you actually face something, it's not as bad as it is as you think. And I feel like that happened a few days ago. I fluctuate in and out of that with the heightened emotions that I have about the state. But it really was this, okay, if we're really here for the next month, how can I somehow connect back to mindfulness? And so I guess my question to you is, what are your thoughts on that? Or for people that are struggling to just be, and we're going to take all factors out, like domestic violence and all that. Let's just take all that out. But just in general, people that, are struggling kind of with what we're talking about with anxiety disorders, that are trying to adjust to this new norm. I don't want to get into other social issues that are impacting people's fear and stuff, but what are your thoughts on that?
Yeah. So the mindfulness thing is crucial for us. So anyone who treats OCD and anyone who lives with OCD and battles it every day, the concept of mindfulness and being present and aware of what you're going through is fundamental. It's crucial. And so whether you're doing specifically ERP kinds of treatment or not, Chrissy, I think anyone who's battling severe anxiety and OCD has to be aware of what is going on around them, how their body's responding, and how they would normally react. And how do you apply those principles, whether you're in an asymptomatic phase or there's something coming on the horizon. So when I'm talking about kids right now who I'm seeing doing really well, I want to be very careful and say that I'm seeing them being asymptomatic, but I know what's probably coming around the corner. And I'm encouraging parents of kids with OCD or parents of anxious kids to be still very mindful that let's enjoy this sort of moment of civility and calmness, but let's not forget the practices and the principles that we've been teaching you and your kids, and the reduction of family accommodations, to make sure that we're still instituting these on a regular basis. Because when things come back to a more scary moment, I hope we've still been practicing these. On the flip side, most of the adult people that I personally work with who have, and most of my adult clientele have OCD. I mean, they have different kinds of anxiety, but 90% of the adults I see have some primary version of OCD. I'm not here to say that I'm seeing the same reduction of everything's kind of okay and easy. In fact, though I've seen in other places where people are like, oh, they've been working for years to be ready for this moment. I hate that line, because I just don't believe that concept. But there are skills that people have learned in the process of ERP or ACT, acceptance commitment therapy, of staying with the anxiety, staying with the uncertainty, taking control in your life, and doing things that you believe in, that bring you joy, that you're invested in, as opposed to just chasing away anxiety. So the concept of mindfulness, of being very mindful of what's happening around you, being mindful of what other people around you are doing, being mindful of who around you is struggling and who's doing well, and reaching out to those who need help, or being open to receiving help if someone's coming to you. That's a level of mindfulness. I do mostly an ERP kind of practice. Several of my team members are much more ACT trained. I'd say I'd call myself ACT informed, but I'm through and through an exposure and response prevention kind of provider. And so with regard to how someone right now is struggling with anxiety or OCD, whether they're connected to OCD Gamechangers, or they're seeing a therapist, they take medication, or they're just out there sort of pervading the field of social media, I'd encourage anyone with any kind of anxiety or OCD to really be thoughtful of, how do you find your comfortable places? What skills do you have to seek out discomfort and uncertainty, not danger? I'm very clear about, I'm not promoting danger, but being okay, being afraid, and being in discomfort, and still doing things that bring you a lot of joy. And that's what I would promote to anyone who's asymptomatic, or who's severely struggling, or who's been preparing this for 20 years because they've been in active treatment, is you're going to have to sit there and tolerate a lot of uncertainty and angst, as you've described with you and your husband, just in the financial realm, and still live as full and informed life as possible. And so I think most of us are pretty scared about the financial prospects we have up ahead. I have a handful of friends who, whether they have mental health struggles or not, are unemployed and are going to have a hard time finding a job. And I'd encourage them to think about the principles that we talk about in ERP, which is do things that help you stay with fear and stay with uncertainty, go after things that you really want and take control of. And I think that is sort of agnostic
I love
to any
that.
condition, any disorder, any stage of life, because I know this specific fireside chat and all the work you do is really targeting the OCD community and people with pretty severe anxiety. But I think what you're promoting and what I try and promote in our very niche practice, I would apply to anybody. And so no one wants to have OCD. And we both know that OCD is on the top 10 World Health Organization's most debilitating diseases. And in a very sad way, I tell people, if you come into our practice, I'm very sad if you have OCD or hardcore anxiety, but I'm thrilled for you because there's amazing treatments out there.
Mm-hmm.
So your life might suck without treatment, but if you can engage in some kind of mindfulness or ACT or ERP-based lifestyle, you can really have a very fulfilling, engaged life. And I would apply that concept to anybody, even if they don't have OCD. Anyone who's trying to figure out employment right now or what they're going to do with their kids, uncertainty is around us. Stress and anxiety is around us. So, Chrissy, I think everything that OCD Gamechangers promotes and everything that anyone who advocates for and or treats OCD has been working on for the last 20 to 30 years, these principles of face your fears, stay with uncertainty, and go after the things that you really love and believe in, do things with intention. Mm-hmm. Don't sit there and be passive. Go after things that you want, lean in. All the phrases that you and I have heard, these apply to every single person in our country right now who's terrified of tomorrow and next week and the week after. And so that's what I love about ERP. It's what I love about the work that I do, the advocacy that you're doing, the principles that you have used and have gotten you through the worst moments, I think can apply to any one of our friends and loved ones who have no idea what OCD even is.
Mm-hmm. Oh, I agree. And I think that this is, and I do it again, I'll repeat, I think I've said this before on a fireside chat, is most of the clients that I see and provide peer support to, they could care less about the coronavirus at this point. It's like, okay, coronavirus. Like, I'm just worried about this. And it is this, that kind of the unprecedented, I have been through this, and had to, and I may have mentioned this on the last one, I'm not sure, but I have been through this to a degree where I was completely alone and had to somehow cover this up with finesse and still be able to interact socially without looking like I was really losing my mind. And now it's all around me and I feel relatively settled with it. And I feel the same way. I feel the same way in regards to OCD and coronavirus. I don't necessarily feel that way emotionally, which I'm just more of an empath. And but either way, I think that that's a good reminder, and it's a good reminder to me, Josh. So thank you for that. Is just remembering that I have the tools, and if people don't have tools, here's a question for you, really quick, before you comment. If people who don't have OCD don't have ERP tools, because we know you have to learn it. You have to learn how to be okay in uncertainty. Where can they go to find out what strategies they can use right now in this massive time of uncertainty? So
it's a tricky question. I can give you some really deliberate, real concrete answers, but I don't think most people who know nothing about OCD, some weird English in there, would know where to find anything that we do. But I think anyone who's probably on social media, Facebook, Instagram, anyone who's sort of watching or trolling any listservs who are seeing other people talk and express concern, mom groups, doctor groups, small business owner groups, hopefully they're reaching out to other people. I can't tell you right now, hey, if you don't know anything about OCD, reach out to your organization or the National Organization for OCD here in the country, or the Anxiety Depression Association of America. But that's where I would start. Honestly, for anyone who's completely naive to anything to do with mental health, I probably recommend starting out sort of more of those academic organizations like the International OCD Foundation, ADAA, the Anxiety Depression Association of America. Here in Georgia, it's the Georgia Psychological Association, which is a state-based organization of the National American Psychological Association, NIMH, the National Institute of Mental Health, even the CDC. If you go to the CDC website, which most people don't know, first of all, the CDC, which is the only federal agency not based in Washington, D.C., it's here in Atlanta.
Woohoo.
In Atlanta. And most people don't know that CDC actually is a Center for Disease Control and Prevention. So the CDC has tons of resources on their website about mental health prevention and smoking cessation and cancer prevention, all sorts of prevention-focused things. So I'd probably say if anyone's really out there struggling in general with mental health, first thing I would do is find their local psychological organization. Most states have a state-based psychological organization. Again, here in Georgia, it's Georgia Psychological Association. If yours doesn't, I'd be shocked if most don't. I'd probably reach out to some national organization like the American Psychological Association. And those websites are overwhelmed with resources of everything you can name, from depression screening tools to anxiety screening tools, and almost every one of them. Again, I'm members of the American Association for Behavioral and Cognitive Therapies, which is abct.org, or the American Psychological Association, which is apa.org, or the Anxiety Depression Association of America, which is adaa.org, or the International OCD Foundation, iocdf.org. Almost every one of them, you can go to there. And there are a bunch of monkey therapists like me on there who have put ourselves out there as, hey, if you need to find a therapist, we have either paid some money or registered for some website to find us. And so I'd encourage anyone who wants direct mental health care to go to a sort of national.org organization to find local clinicians and mental health providers in their community. But for basic resources and information, I think the American Psychological Association, for what we do, IOCDF and ADAA are great resources. Of course, for anyone who's specifically struggling with OCD, Gamechangers, and what used to be Intrusive Thoughts.
Intrusivethoughts.org, yeah.
Which is now a million.
Made of Millions.
Madeofmillions.org. So there's a bunch, and most of those I think are linked on your OCD Gamechangers website. So that's a starting point. But I think a lot of lay consumers really wouldn't know those kind of resources. And so
that's not, but they may not even know they're struggling with anxiety. Right. That's what, as you were talking, I was this light bulb hit of, well, I didn't know I was struggling with anxiety when when OCD first showed up at age 8. So what if people don't even know they're struggling with anxiety right now? They just think they're following the norm, but their every day is consumed with this need to do something or else.
So this is where I think a real positive can come out of what's going on right now with this pandemic, which is we are all so focused on, and this is going to dovetail to OCD specifically, because you and I know until recent years, I'm jumping all over here, but the date of onset of diagnosis or symptoms showing up for OCD until when someone finds an OCD specific provider, just until a few years ago was like 17 to 20 years. The most recent research I've seen is about 10 to 12 years, which is, if you start having symptoms around age 5 to 7, you didn't find someone until around age 17 or 18. And I believe in the next 3 to 5 years, we're going to see that really shrink down to probably within 4 to 5 years, because there are so many good resources like yours out there educating parents and families of kids who have anxiety and OCD to get resources from someone like me or other providers around the country. I think that statistic's going to shrink. But historically, and as someone who grew up in a family with siblings who had anxiety, they got crap treatment back then. And it's disturbing. So I think
rubber band snaps.
Yes. Yeah. Back then, just medication. Just medication that wasn't indicated. So I think the concept of, if you have OCD, which a lot of people don't even know what OCD is, and it's not just about hand washing, it's not just about being orderliness and clean. That's really a small part of what OCD is. I think for many people in the OCD community, there's been so much great dissemination and education about the subtypes of OCD, which you may not see in the books that we diagnose with, but they're all over social media. They're all over most of the good books that you guys write, that my colleagues write. The concept of Puro, which is, an academic debate. Anyone who's in the OCD community knows it's a concept. And the question is, what do you want to do with it?
Nickname for a community. Yep. That's all it is.
So if that empowers someone to get help, that's great. But how do we empower lay consumers or people naive to mental health? And I think I'd love to see that in the next few weeks. We all have a collective discourse, not just on how amazing the nurses and medical doctors are in our communities, which they are. And I just wrote a blog post on our website about the healthcare system and reform and helping doctors and us doing pro bono work for doctors. And I'm doing some where I'm doing sessions for doctors in my local community for free just to support them because they're on their front lines of illness. So I'm hoping that there's beyond just are you sick? Do you have coronavirus? Are you wearing a mask? Are you getting diagnosis? The medical focus right now, there is an undeniable mental health or psychiatric focus that some of us are very comfortable talking about, like you and I. I talk about this stuff all the time with friends, family. This is all I talk about. So it's just my second nature. But you and I have loved ones and friends where either you don't talk about it, or they don't know to talk about it, or they have no one to talk about it with.
Right.
And so I think my first response, or my biggest response to that, kind of the long-winded answer to your question, is if you know someone who you think is struggling, reach out to them, talk with them, ask them if they need any help. Or if you're struggling, ask someone else for help. Unfortunately, most of this is not going to be in person today, Chrissy, but the neat thing is all of us have cell phones. All of us have access to Zoom and VC and Skype and FaceTime and all these technologies that are out there. And it would be very sad if someone is struggling and doesn't have someone to reach out to, despite the fact that we're all either social distancing or physically distancing. We all seem to be interconnecting with each other even more today, oddly, through forced mediums like this. So I would encourage anyone who's struggling at all, whether you have any history of mental health problems or not, whether you have lived experience or not, to talk to a clergy member, a rabbi, someone in your community, a counselor at any,
OCD Gamechangers.
Anyone at OCD Gamechangers.
Someone just at least to get some sort of connection to people who get it.
And my hunch is right now, almost any therapist in America, if I got a blind call from someone and said, I'm struggling and I need help, any one of us is going to stop what we're doing and help them. If not for a few minutes, for a day or two, and find them to the right place. Most of us who do what we love and do this for a living do that all the time anyways. We get calls all the time. They're not really for people that we normally see, and we still spend time with them. We find out who the best people are and get them connected. But I would encourage anyone who's struggling to find someone to connect with and talk with. And if they're really finding themselves all alone, to either reach out to local mental health community organizations or to local religious institutions who usually have clergy standing by ready to facilitate or provide counsel for free, because that's what they're meant to do. So I hope we spend more time, in addition to praising and thanking the most amazing medical providers in our country, acknowledging that there's a real mental health side effect to this, and that there are mental health providers around this country who love their jobs and who, work really hard to help people, and do this every day, that they can reach out to us. And if we're not the right person, most of us are pretty competent and kind to help them find that right person. That's what we love doing. And anyone who doesn't do that, shame on them.
I agree. And I think that my takeaway from all of this is that maybe there's a need out there, even just for a very simple, easy blog as well, for people on just like ERP life lessons of how to navigate uncertainty with just the simplest of tools. I mean, it's
an easy blog. Do you mean my 17-page op-eds that I wrote recently were not easy?
I didn't say that you should write that, Josh.
I started small, went big, and then it just went too far. I started talking about music and then the breakdown of healthcare, and 20 pages later, it is what it is. I love that piece. It's, in fact, when I wrote it, some family member said, Josh, that's not a blog. That's not, so I had to change. It's not even a blog. It's
Josh's blogs are actually just books that haven't been published yet.
I don't like books. I don't believe in that stuff. I'll let you guys do that stuff. So, honestly, if I had his ear, or any professional's ear, whether it's my governor or the president of the United States, as we're sitting up there showcasing Dr. Fauci and the other doctor and these people who are really the best and the brightest, who are overseeing pandemics and prevention and medical care. And we need that. And we need science-based information. We need public dissemination from the pulpit of the White House. Whether I agree or disagree with how it's being handled, we need that information. Boy, would I love to have a mental health provider sitting next to him saying, oh, and by the way, if you're struggling with mental health issues, contact the APA, the IOCDF, Gamechangers, your local stuff. I would love to know that at some point they prop someone up there and say, if you're struggling with stress, anxiety, depression, OCD, post-traumatic stress, substance abuse, don't forget about these organizations, because there's people standing by. And sometimes sad that we have to remind everyone that there are really good clinicians sitting by ready to help out. But like most people, it's just easier to just keep it to yourself and suck it up and white knuckle it. And you and I both know that ends poorly for most people.
Well, and I think that, I said this in the Fireside Chat with Patrick and Margaret a couple of days ago, is, we really are going to see the uptick in the next 6 months of how this is going to impact people with mental health. And I sure do hope people are up in arms about there not being mental health beds.
Yep.
The same way that they're up in arms that there may not be physical health beds, because people are dying in Colorado daily because there's not enough beds for mental health. So my hope, I'm, hanging on by a shred, but my hope is, maybe we really turn an eye to mental health, because after this crisis, we're going to need it. A lot of people in the aftermath of the financial crisis we're going to have, people are really, really going to need the support and the help. And it really is going to be the heroes on the ground floor are going to be the mental health workers and the people that are doing our best to support those that experience the fallout for mental health?
Most research I've read, and going back 20 plus years of my background in graduate school, of doing a lot of work in the space of sexual trauma and other kind of traumas with kids and other populations, and just my experience in the last 20 years of being a professional, this is a terrible thing to say, but I feel like I've lived it and experienced it. Most of us, when we're physically traumatized, injuries, car accidents, gunshot wounds, horrible stuff, we find a way to sort of get it dealt with and move beyond it. And we all see someone's scars and injuries, and there's a conversation to be had because we can see it. Mm-hmm. And you and I right now are talking very sort of somberly about sort of the walking wounded, the invisible sufferers, the people suffering in silence. And that needs to be addressed. I mean, that's what you and I spend all of our waking hours thinking about and doing, is advocating for mental health. And unfortunately, we are still not as pro mental health of a country as I wish we were. I think you and I and the people who are in our space do a lot of work to destigmatize mental health and make services very accessible. I use a lot of humor and music in my practice. I'm a very serious clinician. I've been trained by, I think, the best scientific practices, but I don't know how to do it without trying to make it a little bit funny and silly. But it's not funny to me, but you have to bring some levity to it. And I think people are so terrified of talking about mental health because it means there's something wrong with them. On one of your recent Fireside Chats, you quickly turned someone using a word as an adjective, which I like that you did. And we don't use, we don't say, oh my God, you're so cancer, you're being so diabetes. We don't say that. We say you're being so crazy.
I did. I remember that.
So OCD, so schizophrenic. We so easily say that because in the last 50 years, that sort of lexicon became a way for us to blame people for their emotional struggles. When we never blame people, mostly not, for medical diagnoses. So we're not there yet, but Gamechangers and all the organizations out there that break all the barriers of the doctors up here and bring the autism community and the OCD community, to me, are the two best clinical population communities that really do a great job when you go to whatever their national conferences are. And actually, I'd add the selective mutism community as well, where when you walk into the conferences, you don't know who the patients are, the lived experiences are, the loved ones are, the clinicians are. You might know who some of the famous book writers are, but we're all walking around with name badges and you don't know who's who. And I love that because that proves that it doesn't matter who you are. We're all doing this together. So, hey guys, hey Kathleen. Some nice people saying hello. I love that. I love that about the OCD community, that really when we all come together, whether it's a local event, I'm on the board of OCD Georgia here, or the national events, you just put one on recently in Colorado, or another one that may happen this summer. When you go there, aside from these color-coded schemas, you don't know who's who. And that proves that you can remove these barriers of ivory tower doctors and only these special people get best care. Everyone deserves best care and everyone has access to it. And we're not there yet. And I really hope we get there. But I would love to see a more public acknowledgement of the emotional struggles that people are experiencing right now regarding finances and medication issues and, the fears of delivering a baby without your partner there and not being able to go to my loved one's funeral and delaying my wedding. And my daughter, who just turned 13, had to postpone her bat mitzvah by several months. And I wrote about that in something else. And major kudos to her because, she and other kids like her could have handled it differently. And I think she handled it beautifully. And, it's a major disruption to loved ones who are up around the country. But the way she handled it proves to me that she's ready to have her bat mitzvah. And I think that's awesome. But, there are people that are having real life events like graduations and funerals and
grief that's going to come as a result of that is going to be terrible.
So, but I want to be mindful that there are people who have been working for several years who have OCD specifically. And this is the population that you serve the most, who, because they're socially distancing or physically distancing, sadly, most of the things we advocate for them to do usually are outside the house. Any exposure you're going to do is outside the home. And so I think one of the things that we need to pay attention to in the OCD community is if you're struggling with OCD and you've been working really hard to use either ERP or ACT or other sort of evidence-based interventions to treat it, that I am aware that there are limitations right now to you being actively involved in your treatment. But that doesn't mean you have to be inactive and staying connected to people, which brings us back to your point, which is staying connected to people, talking to people, and being open to be vulnerable emotionally. I think we'll get all of us through this, no matter your experience or entry level into mental health. And I hope we work hard to advocate that people really, open up their neighborhoods and their homes when we physically, or, even if we physically can't, to be an available counsel to anybody. You don't have to be a therapist to help someone who's going through a tough time at all.
I mean, and some suggestions, and I want to ask you a really important question too in just a moment, and kind of turn it a different way. But I want to give some healthy suggestions. If sometimes you feel like I don't know what to do,
Yep.
and how to support people, or you think to yourself, well, I don't even know that people are struggling. Well, this is a great time for us to learn as a society. It's okay to ask if someone is struggling and if someone needs help. It's really hard to ask sometimes, do you need help? And then it's also hard to think, well, what if they say they do need help and
Yeah.
I don't know how to help them? Do
Yep.
you know what the best way to help someone is? To listen. The best thing that you can do with someone who is struggling is to listen to them. Now, listening takes practice. Listening does not come natural because we are usually formulating what we need to say back or how we need to fix someone or how we need to give advice. People are not going to want your advice during this because people are going to feel different, very much in a different space depending on how they're going through this. So a helpful suggestion would be this. Reach out to people, even if you think they might be doing good, and let them know that you are there to listen. Practice listening. Practice listening with your family. Sit down and ask them how they're doing and just let them finish their thought. Learn how to sit in the silence and then learn how to just validate people instead of trying to give them some sort of advice or show them that they could do this and this could be better. However, if someone does tell you that they are experiencing thoughts of wanting to harm themselves or suicide, please contact or please support them in calling 911 or taking them to the hospital or to a mental health crisis center. Because if someone does have a plan or if they're expressing that, please take them seriously and be a support to them at that time. Now, with that said, I do want to ask you a question. I saw this on Facebook, and I know you're not a medical doctor, and that's fine, but I did want to, but you are a doctor, and you do have a lot of knowledge about OCD, and you're going to understand this question in regards to OCD. A lot of people are at this point now who may have contamination OCD that are going, well, this is what I'm supposed to be doing for ERP, but this is what I'm being told are the guidelines. Which do I follow right now to keep my ERP plan, and how can I can't remember how it was worded, but it was more of asking the question of if a medical doctor is saying that these are the requirements and this person is being asked to do beyond that because of their ERP, what can people do right now that are in that position, and how do they know that it's okay and that they're still safe?
So you're now hitting probably one of the hardest and most confusing topics within the OCD community, regarding the appropriate measures you take to stay medically safe and the extraneous measures you're taking to feel safe. And those are really two distinctions that prior to coronavirus, I think most clinicians, forget people that are in treatment, but most clinicians had a pretty clear understanding of that's extra. That's a ritual. That's a safety behavior. That's too much. Getting naked in the garage and going into your house in January so you don't get people in your house sick, we all knew that was extra. But I have colleagues and loved ones, family members who are medical providers who actually have to do that. So, Christy, I want to be very careful and almost not answer this question. I don't want to talk out of both sides of my mouth and circumvent it, but the reality is those regulations and those recommendations are changing every day. A week ago, I saw the most ridiculous video that people have seen on probably YouTube and Facebook of this doctor in, I think, Michigan or Wisconsin, really great guy, trying to be very well-intentioned, who's out there, putting his life on the line with a piece of blue tape on an island showing, here's how you take groceries home. I know, hold on. And here's how you clean each piece and bring them over here and then put them in the sink. And I watched it, honestly, a few days ago and thought, that's absurd. That's extra. He's not actually, this is my personal opinion, not professional. He's not reducing the risk to a perfectness where he's actually guaranteeing he's not going to get sick, but he's mitigating the risk a lot. And then this morning I saw a modified version of that clip from one of my favorite people in the world, Sanjay Gupta, doing it. The lead doctor that we all sort of look to in times of craziness. I think most of us trust him to be sane and give really good sound medical advice. And he actually took the video and said, actually, to be honest, guys, and I'm going to put glitter on these cans and show you, like, if you're going to clean these things off, whether you wear gloves or not. And he said, you don't have to wear gloves. Here's how you take cans and boxes of pasta from this side of the island to this side. So he is perpetuating or purporting what this doctor a week ago we all thought was insane. And now I'm seeing Dr. Gupta go, okay, well, actually, maybe that's sensible. So I think the best thing for me to start off is by saying most people who have OCD, I think, have a good gut sense when the dust is settled, when everything's calm, to know what's a ritual and what's not. Not everybody does, but what's a ritual and what's not. And if they don't, obviously, I'm hoping they're talking with either a mental health provider or someone that they trust dearly to help them make those decisions. But it's a tricky one for me to answer because a few days ago, if everyone was wearing face masks or rags, I'd say, well, that feels excessive to me. And boy, am I not going to do that. And before I went to work this morning, I was watching the Today Show with my wife this morning. And now the pretty much recommendation is to wear face masks or anything, not so you don't get sick, which is what I actually thought it was for as a lay consumer. I'm not a medical provider, but so any droplets you have in your mouth don't go out in case you're an asymptomatic carrier. Mm-hmm. So it's a tough one, Chrissy, because you're asking me or asking anyone to say, should you or should you not wash your cans? Should you or should you not wash your hands before every meal? Should you or should you not take off your shoes and strip down before you go in the house? I went to the grocery store yesterday, and then I came into my office here, my practice. And so my entire team knows I'm the only one, actually there's one other person here each day for this week, and we're at opposite ends of the hall here, that when I walk out of this place, and I believe I'm asymptomatic, whether I'm a carrier or not, I'm at home with my family. My kids have not interacted with any children or other people. My wife's probably gone to the grocery store once or twice in the last week or two. So I'm the most active outside the home person in my family, and it's not that active. But when I leave my office, I'm Lysol wiping every doorknob, every handle, every faucet, and every surface I've touched, because I believe it's the right health thing to do. If we're not in coronavirus pandemic phase, am I doing that? Absolutely not. But right now, it feels like the right thing to do because I'm trying to keep everything as sanitary as possible. I'm trying to be respectful that I might be a carrier, even if I'm asymptomatic. So I'm following those protocols. But I would think that, that seems like an extreme measure 3 months ago, and I'm hoping 6 months from now. So I didn't answer your question, and I'm hearing that loud and clear, but it's a tricky one to answer because almost every other day, us lay consumers are watching new regulations of what's being recommended, where right now it's being recommended that probably most communities are truly going to the extreme measure of lockdown, so we can have 2 or 3 weeks of very extreme social, or I guess physical isolation, to reduce asymptomatic people from spreading it. So I didn't answer your question, but I think it's a tough one. And I would encourage anyone who's in active treatment to talk with their healthcare provider to figure out, what measures are best.
It's a balance.
It's a balance, and it's a personal decision. I think anyone who is judging someone going to the office or not doesn't know everyone's situation. And I think
Thank you.
Yes.
Thank you.
And I think anyone who is choosing to wash extraneously or not, if they don't battle OCD, I think that becomes a very personal decision for your own sense of safety. And I'd encourage anyone to think about what is the ultimate cost. Several adult patients I see who have health anxiety and other conditions are terrified right now of coronavirus. And I'm watching them give up their life and being more socially isolative at home while their wife and or kids are leaving their house and going to the cul-de-sac. And I'm thinking, well, I'm not a medical provider, very clear about that, but I don't believe you walking outside in your neighborhood, being away from people, violates any health recommendation. Mm-hmm. So for me, it's not my gut. That's what good science tells us, which is it seems like that's not necessary. But he's choosing to do that, and he knows that he's missing out on family time. And so I don't support him doing that. We've talked about, well, we both believe that's a ritual. He knows he has to lean into that and go towards that, and I hope he does. And I actually meet him with him, session with him today. But to me, that's a pretty clear example of that's too far, because there's nothing that he's doing that I believe puts him at risk by walking outside. And if he believes his doorknobs are contaminated, well, he can wash them if he wants to, but that's not the issue. Mm-hmm. So, Chrissy, it's a tough one because in the OCD community, you and I have pretty clear guidelines about what's ritualistic and what's not, hand washing rules and rules about using toothbrushes and what you wash and separating laundry and using special baskets. And most of us say those are mostly ritualistic behaviors. But sadly, today, I would be very cautious to accuse anyone of being overly ritualistic because I just think that's again, it's stigmatizing, and everyone has their own personal preference. And I think all of us are trying to figure out how do we keep our families and our loved ones as safe and healthy as possible. So I'm not even giving the answer to that one. I would recommend you talk to your healthcare provider. If that's not helping, I would talk to a medical provider because I think they probably have the best information. I'd recommend people go to the CDC or World Health Organization's websites to see what are recommended. But as I watch Sanjay Gupta's moving stuff from one island side to the other, I just think I'm personally not going to do that. Mm-hmm. I don't think that makes me better or worse. It's just I'm not willing to take those steps, and I'm willing to take that small calculated risk because I still get the mail and don't wash my hands. And I took my garbage dumpster out 2 days ago, and the garbage men put it in the big truck and put it back on my driveway, and I dragged it back to my curb, and I don't wash my hands. So if I'm going to wash my hands with groceries, but not wash my hands with the dumpster, like at what point, which one really matters? So I'm just trying to calculate when I feel like I've been in a potentially exposed moment. So when I go to the grocery store, something I've never done, when I get back in my car, I put hand sanitizer on my hands. I've never done that before in my entire life. And I hope to God never to do that after we're done with this. But I'm doing that now, in addition to wiping down my steering wheel, which I hate doing.
Mm-hmm.
But right now, because I go from grocery store to my car, those are immediate physical places I touch. And that's what I'm choosing to do. No one's taught me that. No one's recommending that. But that's what's making me feel mildly better. But the second I touch my gear shift, it's all gone. It's just crazy. I know. So it's a tough one.
And I think it's important to remember that we do have the guidelines of the World Health Organization and the CDC. And again, I like that you use the word choice. It is a choice. Some people are going to be way more extreme, and other people are going to make the choice to do what they need to do to feel safe. And the balance comes with OCD of when you're doing too much because you're actually just responding to anxiety in regards to OCD. I also just want to point out, and I am not a medical or therapist or anything, but talk to your therapist if you're struggling with this. And a therapist can actually come up with things that can still challenge your contamination OCD within your house without having to go out like you would normally do. As you said earlier, Josh, most people are challenging these things by going out of the house. But OCD is OCD. It comes from, a part of the brain that can be challenged in any sort of arena. And so your therapist can help you figure out in the confines of your own house, even without bringing other things in, that you're continually able to do exposures inside the house that's going to challenge that part of the brain and learn what response prevention is. I don't know if you would agree with that or. Okay.
I'd also challenge you, and you're the host of this wonderful program, so I'm going to totally be rude. You're a liar. You are a therapist.
No. Oh, shit. I said something awful.
You may not be a licensed mental health professional, but I would argue that any person, as you said, who's willing to listen is the definition of a therapist. I know there are certain people who are trademarked and licensed and credentialed. And as you pointed out, if someone's in danger or very seriously ill and they need to be seen by emergency services or a trained mental health professional, I don't joke about that. I'm very serious about that. It's on everyone's consent forms. But Chrissy, you are as much of a therapist as I am when I remove whatever credentials I have, because you are an advocate, you're an available ear. I know if anyone in your circle needed you, you'd be there for them in a second. And I hope that they would reciprocate for you. So I want to extend that, which is everyone who's watching this, listening to this, whether you're mental health trained or not, anyone who is available to listen, you're a therapist, which means we have several 100 million therapists in our country standing by ready to help each other if they're willing to listen and be supportive and available. And I think that's, not everyone can be a medical provider, but anyone can be a person who has empathy and sympathy and kindness and compassion. And that's what right now everybody needs. I want to add one thing to my long-winded lack of answer to your ritualizing regarding hand washing. Just because we're being asked to social distance or physical distance does not mean you have to lock yourself in your home.
Thank you.
I want to make that loud and clear. Hi, Felice. But I, again, wrote a little piece that was what it is. But we took social distancing.
It's not a little piece.
Well, the first one was good. The first one was about being COVID blues. That was a smaller one. It was a fun video from my team. The second one was a beast. But the reality is I think if we get away from the concerns about medical contamination or COVID contamination, I don't want to nickel and dime or debate that, because everyone's going to take their own precautions and follow the recommendations they believe are best. But I don't believe we need to be all sitting in our homes isolating ourselves. And my biggest concern for anybody with OCD specifically, anyone who battles anxiety and who's also battling concurrent depression, anyone who experiences any kind of mental health concern for which social isolation exacerbates the condition, I beg you, I pray that you get outside of your house, 6 to 10 feet away, wear whatever scarf you need to, and have a live conversation with someone. Stand mailbox to mailbox, or sit in your cul-de-sac, or get in the back of your car and prop up the back gate. But there is no reason why people need to be physically and socially removed from each other, but they can also keep very safe medical distance. And I'm not a fan of people going to parks right now and having thousands of people in a park. I don't support that, because right now I want to get back to work normally, and I want my kids to get back to school, and I want to kill the curve. I don't want to flatten the curve. I want to get rid of the curve. So I believe that truly eliminating contact with each other right now is crucial, but that's not social contact. And I don't think it all has to be over these telemediums, because even though this is an easy way to do so, it's exhausting and very disconnecting.
Lose the human connection.
Very much so.
I would so much rather you be sitting right here, right now.
I'll be there in 5 minutes.
Just so you know, on Monday or Wednesday, whenever I talked to Margaret and Patrick, we just to drive your point home, we were even talking about like how great it is. I'm driving around my neighborhood, like waving to people, like, hey, you know, or rolling the window down and being like, how you doing today? I just want to thank you for saying that and emphasizing that point. It's so important for human beings in general, but those of us with mental health struggles, it can make the whole day. Everything. It can change the whole day.
It doesn't matter what topic or diagnosis you have, whether you have a lived experience or mental health struggle or not talking to people for multiple days at a time and not seeing them, anyone would be destroyed by that. Social isolation, neglect is brutal. Funny side note to lighten this up a little bit, driving home from this office a few days ago, and I saw the best entertainment possible, which became a social opportunity with people keeping their distance. As you know, here in Atlanta and suburbs, there are some old big trees, pine trees and oak trees all over.
Oh, yeah, you can't see the skies?
No, with limbs all over the place. And I drove home, and I'm watching this family in the front of our neighborhood all looking up as these tree people are knocking down limbs, and I look at the ground area, and 3 different houses around them are in their driveway, in their chairs, just sitting up and watching this. Like, that's the new form of entertainment.
What are tree people?
People who bring down tree limbs and take trees down. Tree removal services. Yeah, sorry.
Like, are these just random people? I'm like,
no.
hashtag Georgia.
With the limbs falling. We've had tons of rain here the last few months where roots are popping out and trees are falling. So just for prevention of limbs falling on roofs and stuff. But I drove this little cul-de-sac with one house having tree limbs removed, and it was like, a party out there, keeping social distance. Everyone just looking at a tree and just having the grandest old time, but talking to each other. And I thought, what a basic, neat way, pretty expensive way, to have a block party by having tree limbs removed. But that can still happen, which those moments brighten the day. And I really would encourage people, OCD or not, to not lose our social connection with each other and still maintain whatever physical or social distance you need to. I love hearing stories of people having these birthday parties outside. My daughter's birthday party last week, she did over Zoom. But I'm seeing videos on Facebook of people lined up a street with cars on top of their cars, like playing music. Like, that's just, you can't do that ever. 6 months ago, you looked crazy. But now that's what people are doing to find new ways to connect with each other. And I think it's hilarious and beautiful and awesome. And why the heck not? Because sitting in our offices or in our homes on this video screen, it's nuts.
I know that was not very strength based, but okay.
No, it wasn't. There's I'm a big music fan. Pearl Jam and another band, Fish, are 2 of my big influencers.
I know, and I think you have something to show us before we click off.
I'll do the big reveal in just a second. But Pearl Jam years ago had a great heavy dark song called "Do the Evolution," and it was a video. It was a cartoon video back when MTV and videos were cool back in the day. I know. There's
the 80s.
The 80s. I don't 80s, 90s never came out, but "Do the Evolution" has this just wild cartoonish video of the evolution of our civilization, and it's so prospective or prophetic, where you're watching like these cavemen turn into humans, turning into computer people all sort of being zoned into computers, being wired to computers, to just us pecking at computers, and there being no world, and in a very negative way, technology, which is so amazing right now for us to connect. I feel like we're so sunk into this. It's giving you the platform to reach out to as many people as possible. But I sure hope when we're beyond this that we find a way to disconnect even more and hug, hold hands.
Well, I'm going to be hugging. Yeah. I know that they're saying that hugging's not going to be, hugging and shaking hands isn't going to be part, but I'm going to be hugging. So if you don't want to hug, don't come near me, people. I'm a hug.
Same.
All right, listen, just wanted to let you know that Felice Becker let us know it was called Tree Trimmers.
Awesome. Thanks, Felice.
Thank you, Felice. But I like tree people better because I just imagine like people that were living in trees. Final words, Josh. So good to have you on here. I just adore you, and I can't wait to see you in person. Give you a big old hug this fall when I'm in
Thanks.
Georgia. We're gonna do a pop event. But please let us know final words, and then I will wrap us up afterwards.
My final words are very simple. I'm a long-winded person. I will keep it very simple, and that is connect with people. It solves isolation. It solves not feeling like you can talk to people. It solves why we're in this certain situation right now, which is physical and social distancing. You can still connect with people, and that can be writing a letter to someone that you love, or a nursing person, or a medical doctor. And that can be calling a friend you haven't talked to in 6,000 years that you found on Facebook again. And that can be getting into your cul-de-sac, being 6 feet apart, cracking open a beer or having a glass of water and just sharing what's going on in your life. Connecting with people right now for me is absolutely the most valuable tool we have. For people who struggle with OCD and anxiety, it's even more important because there's already the stigma, there's already the sense of isolation, there's already the sense that you're doing this by yourself, and I swear to you, you're not. And whether it's to a mental health provider or someone in your community or a stranger online, connect with them, find support, speak up, and I hope you find someone that can hear you, because that's what Chrissy and I promote and believe in, which is listen, be empathic, and be available. And that's it. Just connect with people.
I could not have said it better. The only thing I'll add to that is what I've really gotten out of this conversation I love, other than just being able to spend time with you, Josh, because you're so awesome, is it's so, if you don't have OCD or if you don't have mental illness and you're just here checking us out, you can help people too. You can reach out too. You can be an ear. You can ask people what they need. And we can take away from all of this the ability to learn how to connect differently than we have before. Like Josh was saying, we're so connected from the electronic standpoint. If anything, use this time to be able to really learn how to help support people. Again, a couple things that you can do is just ask how people are doing, give them an ear to listen. Even if you don't understand, you can say, I don't understand, but I'm here if you just need to talk to someone. Because oftentimes when you're living with mental illness, and especially when you're living with OCD, just being able to say it out loud provides enough relief to give someone hope. I know that sounds silly, but if you can be that person that can just sit with someone and just listen and believe them, you can really save people's lives. You can make their entire day. You can give them hope and motivation to even reach out and ask for help. So thank you so much for being here. Josh, thank you for your time. As always, I'm sure we'll have you on again sometime. For all of you that joined us, thank you so much for being here. Our Fireside Chats have just been a lifeline for me, and I know they've been impactful for so many different people. We will continue to bring you content from all of our leaders and advocates and people in our community to keep giving you hope, encouragement, and motivation during this time of uncertainty. And I'm doing an Ask Me Anything, an AMA tomorrow on my Facebook page, sponsored by OCD Gamechangers, with Corey Hirsch, who is a former NHL goalie and Olympic medalist who lives with OCD. So we're going to have a good time. So check me out on my Facebook page. We'll also be at intrusivethoughts.org streaming live, and my YouTube channel at Pure OCD. Wait, Christy Hodges, Pure OCD Advocate. Thank you again, Josh. Love you.
Love you too.
And we will see you tomorrow on my Facebook page and next week at our Fireside Chats as we continue on Tuesday. Bye. There we go.